So, good afternoon, ma'am. I am Brittany. I am your student nurse today. What is your name, ma'am?
Listen,
Listen. How old are you?
17,
And where do you live?
Kalubi.
Calabee. Okay, your name is Lizelle. You're 17 years old and you live in Calabihon, Dalpuga, Eden City. For today, ma'am, I'll be assessing your skin, hair, and nails. And for me to able to assess those parts, can I ask for your permission for if it is okay to touch the part of your body?
Okay na.
I'll be asking you some question about your past history. Meron po ba kayong problem sa skin nyo like rashes, lesion?
No.
Okay. How about drying of your skin, oiliness?
Wala.
No. How about bruising, yung pangangate?
No.
No. How about hair loss? So, sa nails po, do you feel any changes? How about allergic to the food?
No.
No, okay. Okay, ma'am, so I already explained to you the procedure and I am performing a hand hygiene before I start with your assessment. Okay, ma'am, I'll be starting the assessment. First, I'll be inspecting for your color variation, skin integrity, and skin lesion.
Normal findings reveal evenly colored skin tone without unusual or prominent discoloration. Skin is intact and no redent area and without lesion. Abnormal findings: pallor, cyanosis, erythema, acanthosis nigricans, skin color variation like vitiligo and albinism lesion, primary lesion, secondary lesion, and vascular lesion.
I observe that your skin is quite intact. Okay, next, ma'am, I'll be performing or palpate for your texture, moisture, temperature, turgor, and edema. Okay, first, I'm going to for your texture. Okay, ma'am, next I'm going to palpate for your temperature. Next, for your turgor, I'm going to pinch your skin. Okay, I'm going to assess for your edema. Okay, ma'am. I have observed that there are no presence of edema po. And nung tinouch ko po yung legs or feet niyo po, bumalik naman po siya agad. Hindi naman po siya nag-indent. And for your turgor, yung pinch ko po yung skin niyo, meron naman po siya mobility. So, I have observed that your skin is quite thick naman po. And that's good po.
Abnormal findings: dry, itchy skin, diaphoresis, clammy or cold skin, very warm skin, decreased mobility, and turgor and edema.
Next, ma'am, I'm going to inspect the scalp, hair, general condition, and distribution. So, can I touch your hair, ma'am? Okay, ma'am, I don't see any scar and lesion. There are no parasite na present or infestation po. Wala din pong present ng hair loss na pwede pong mag-lead sa alopecia. And wala din po akong nakita na dryness sa scalp. Okay, ma'am. Next, I'm going to inspect the condition of your nails, nail bed color, and angle of attachment and palpate CRT. Okay, ma'am. I observe, ma'am, that your nails are quite groomed and it is clean po, and you have a pink tone nails po. Can I going to pinch your nail po, ma'am? And can you do this, ma'am? Okay. Thank you po. So, I noticed po, no, meron po 160-degree shape yung nail nyo po, and that's normal. And I also noticed po sa capillary fill na bumalik naman po siya sa pink tone ng nails po when I pinch it, and that's normal po. Okay, our overall assessment is okay naman po.
Abnormal finding: pale or cyanotic nails, early and late clubbing, capillary fill of more than 2 seconds.
For your cooperation, ma'am, my advice is eat healthy food, have a healthy diet, and take vitamins and drink water daily. That's all po. Thank you po. Hi ma'am, good afternoon. I am Whitney Loan and I am your student nurse today. So, what are your name, ma'am?
Rizal.
Yeah. How old are you?
17.
So, this video, I am here to perform an assessment on your head, neck, eyes, ear, mouth, thorax, and lungs to ensure that everything is normal. Anyways, how are you, ma'am?
I'm fine.
Okay, fine. Have you noticed any noticeable changes in your face, your head, your neck, your eyes?
None.
Any pain or discomfort?
None.
So now we can proceed to the first part of the assessment, which is the inspection. First thing that we want to inspect is the head and neck. Any sign of discoloration, any sign of the symmetry. Okay, ma'am, I'm going to inspect for your head for sizes, shape, and configuration. Next, I'm going to palpate your head for consistency. Like, I'm going to inspect your face symmetry, feature movement, expression, and skin condition. Can you close your eyes, ma'am? Open your eyes. And smile. Sad. Next, I'm going to palpate your temporal artery for tenderness and plasticity. Okay, can you finish your teeth? Open your mouth. Close it. Okay, ma'am, next I'm going to inspect for your neck. I'm going to inspect for the movement of your thyroid, cartilage, and thyroid gland. Can you please drink this water now? Next, I'm going to inspect cervical, vertebra, neck range of motion. Can you look up now? Look down. To the left. To the right. Okay, ma'am. Next, I'm going to palpate for your trachea together with your thyroid gland. Next, I'm going to check if you are a breathe sound. Okay, I can't hear any bird sound. Next, I'm going to palpate your lymph nodes. Okay, as I inspect her head and neck, it's all normal, and her head is normally hard, and face is symmetry with a round. Her temporal artery is elastic, and her trachea is in the midline, and in her neck there is no swelling, no tenderness. Okay, next I'm going to assess on her eyes. First, I'm going to inspect the eyelids and eyelashes. I can see that our patient eye is normal. The upper eyelid and the lower eyelid is closely easily, and skin on both eyelid is without redness, swelling, or lesion. And for the position of the eyeball is that eyeball are symmetrical, aligned in the socket without protruding, which is normal. For her bulbar conjunctiva, okay, so the bulbar conjunctiva is clear and smooth, and no swelling or redness in the lacrimal gland. Okay, the cornea is transparent, the iris is round and flat, which is normal. The overall assessment in the eyes is normal. Okay, ma'am, let's proceed to your ears. I'm going to inspect the auricle, tragus, and lobule. Okay, it's normal because the ears are equal in size bilaterally, and the earlobes are free, and I can see any apparent loops. Also, the skin is smooth and no lesions. So I'm going to palpate the auricle and mastoid process. Okay, ma'am, please say it if you can feel any pain. Do you feel any pain? Okay, and that is normal. Okay, as I inspect the external ear of our patient, I can say that the canal wall is pink and smooth, and the tympanic membrane is deadly gray, no bulging, and it's slightly concave, which is normal. Okay, let's proceed to your thorax and lungs, ma'am. It's important to note here that when assessing the lungs and thorax, you have to assess them front and back. Starting with the anterior thorax, let's start with inspection.
Make sure no signs of distress, chest expanding equally, and make note of the general rate and rhythm of the breath. Also, look the shape and symmetry of the thorax. Diameter from the front to the back, or the AP diameter, should be about half the length of the diameter from the left to right. Palpate the chest. Feel for any crepitus or cracklings under the skin. This could indicate subcutaneous air, sometimes caused by trauma to the lungs. Let's proceed to percuss the intercostal spaces from the apex down, moving from the left to right. I hear resonance, and that's normal. Next, auscultation. Listen with naked ear first to make sure don't hear any audible wheezes, cough. Start at the apex and work way down, moving left. Next, let's move to the posterior. Auscultate, you should hear bronchial then bronchovascular. Make note of any adventitious sound like crackles or wheezes. Next, check the lung sound in the respiratory course. Inspect for symmetry, skin color, and expansion. Next, palpate the lower rib cage and ask the patient to take a deep breath. Auscultate voice sound. Ask the client to say 99.
99. Again? 99.
Okay, ma'am, as I palpate your lower rib cage, it is normal because my thumb move away and back equally. And as I ask you to say 99, the voice transmission is soft and indistinct. So that is normal. And as I say to you to whisper 1, 2, 3, the transmission of the sound is very faint, which is normal. Remember that any adventitious sound could mean that the client is having difficulty breathing or oxygenating. So make sure you interview appropriately and notify the provider is necessary. That's all. Thank you for watching.